As public health professionals, we're taught to find and understand the roots of problems.
To identify their sources, their origins.
But the roots of health inequity trace to deeply rooted social divisions.
They undermine the health of the nation.
Tackling the root causes of health inequity means answering difficult questions of power and privilege,
Racism and class inequality.
with an eye to social justice.
To reconnect public health practice to social justice, NACHO
The National Association of County and City Health Officials.
launched the Roots of Health Inequity coursework on the web.
It encourages a paradigm shift among public health professionals.
I think the really remarkable thing about this NACHO course is that it gives public health workers, it gives ordinary community people, as well as in academic settings, a framework around social justice and health equity. This course makes it possible through examples from around the country for public health workers to understand there are some things we can do that are important and that really address the fundamental causes of ill health.
And what the Roots of Health Inequity website allows us to do is it gives us content to really make it very clear what are those systemic structural features that influence where people live, how they behave in communities, and ultimately their individual health behaviors, which lead to disparities in health outcomes. So I found the Roots of Health Inequity website extremely valuable for the behavioral sciences course in that it lets us get to the causes of health inequities.
When you're in a leadership position within a county or city government, what could we be doing in public health in general that's a little bit better? You know, what other resources could we be using for a specific population?
I had an older student pop her head into my office one day to tell me that the course that I was teaching and the Roots of Health Inequity website was blowing her mind. And I kind of love that expression. I've kept that in the back of my head because it was so powerful to her to reflect on opportunities that she's had in her life and lived experience that she's had that is somehow now quite relevant given the way the information is laid out in Roots of Health Inequity. She was able to really think about how these larger structural factors has affected her personally and how her choices may have affected others.
I think one of the most powerful aspects of the NACHO course is that it allows public health workers to come back to what they know in their hearts is the root of our field, why people went into public health in the first place. They know that we're really about trying to make sure that everyone in this country is as healthy as they can be. And that requires social justice. It requires equity. It requires basic common sense things. Today in public health, as is often the case, we're facing real challenges. Local health departments are being cut, federal monies and grants are harder to get, and it's so easy to get discouraged and to lose track of what we're really there for. But I would encourage you, and I think this course will help your staff do it, think carefully about why you went into the field in the first place. Ask yourself what you really need to do to solve the health problems in your community. Understand that if we accept the notion that it's impossible to do anything, that's exactly what will happen. Dare to think about the impossible. Dare to stand up and call for what you know is right. Be careful in your health department to be a voice for social justice. This course will help you and your staff do that. And when that happens, when public health takes leadership, the communities will follow.